The first thing they said to me was how to hold this microphone, and I completely forgot to even pick it up. My name's Alice Bell. I head up climate policy at the Wellcome Trust, and I want to welcome you all. Sorry, we have to do the welcome pun. It's actually in my contract. Welcome you all to this event on how health can really boost climate action here at COP29. We have some really great speakers, and we're going to start off with just making sure that she's got her headphones on. I'm talking about someone who can't hear us because we're on the mic. There we go. We're going to start off with the amazing Maria Neira from WHO. And if there's anyone who's going to set the scene in terms of how health can help power climate action, it really is Maria. So Maria is the Director for Public Health, Environment and Social Determinants of Health at the WHO, and she really is the expert on the topic. So Maria, please do give your opening remarks.
Good morning, good afternoon, everyone, and thank you for the lovely presentation, putting me a lot of pressure. Now I don't know what I'm going to say to make sure that I respond to your expectations. We are here today in this special panel to discuss about how to unlock the health benefits from the climate action. And I would like to share an image with you which I think is extremely powerful. At the moment we are talking, 33 million people that live in New Delhi are suffocating because they are breathing an air that goes to between 300 and 500 micrograms per cubic meter. For those of you, I'm sure you are all very much aware and know very well the recommendations of WHO, the standards in terms of air quality. But for a daily average, for a year average, we will expect 15 micrograms per cubic meter. And what we're having today in New Delhi is 300. But it's not just in New Delhi. There is Lahore in Pakistan. There are many other places around the world. So for those of you who are still trying to explain to others what is the face of climate change and health, how do we translate that on a powerful narrative for people to understand that what is negotiated here is not just a level of emissions or adaptation plans or when do we have more ambition, where do we will have the next COP. What we are discussing here is the life of the people, issues related to mortality and diseases that we are coping with at the moment. So people need to understand that it's not only the negotiation of emissions, they are negotiating with how many cases of obstructive chronic pulmonary diseases we are going to have next year, how many lung cancer will develop if we do not reduce this level of air pollution, how many cases of pneumonia, how many cases of dementia and other neurological, neurodegenerative diseases. And this is the first message that I think we need to be very conscious about it. For many years, WHO, in great collaboration with Wellcome, we were bringing to the COPs a huge sculpture representing our lungs, our bronchia, because we wanted everyone to recognize or to understand that the climate crisis is as well a health crisis. And more than everything, at the front line, our health workers are already coping with the consequences for our health of climate change. Most of them, they don't even know that those are the consequences of climate change. Most countries in Africa, they are suffering the consequences without maybe understanding the causes. But this is the reality. You now having an increase of cases of dengue in Japan. We have cases of air pollution-related diseases all around. So no country is protected from these terrible consequences of climate change. The health benefits, I think we need to speak positive now. We need to make sure that everybody understands that it's a disaster what is happening on climate change and how it affects our health, but it's at the same time we have enormous positive, very rewarding opportunities to generate massive health benefits. And those benefits will be exactly what is happening today in many countries around the world. Reducing the bad quality of the air we are breathing, making sure that we are not breathing toxic air that is killing us. On that one, only on that one, we could save the life of the 7 million premature deaths we are having every year. If we add, in addition to that, if we add the cases of diseases which are chronic diseases that will require a very long-term hospitalization and a very expensive cost for our health systems, you can see another enormous health benefit. The second one will come from the move and transition to sustainable food systems. Again, we can reduce 5 million premature deaths every year if we transition to sustainable food systems and we promote, by doing so, healthy diets for the people that we are trying to protect every year. And the third one is very much at the local level, at the urban level, at our city levels. If our mayors, local municipalities responsible for subnational authorities, if they realize that all the interventions they are doing at the urban environment can have an enormous benefit on health. If you put in place a sustainable transport public system, the one that will respond to the needs in terms of commuting of our population, you will have enormous health benefits, reducing sedentary lifestyle and non-communicable diseases. If you make sure that you reduce traffic, you will reduce injuries. You will create more socially friendly environments where we can protect mental health as well. If you put trees and gardens in your city, we will reduce the temperature by even 6 degrees, and we all know how much this is needed with the heat waves that are at the moment increasing and being responsible for mortality across the countries. And then if you use all the technology and innovation we have now to have buildings that are more energy efficient, we can use a heating and cooling system that will be more adapted to the fact that we are in the 21st century. We can then obtain a lot of health benefits. So I will speak positive from now on it. I was very kind of shocked somehow to hear that next year the focus will be on ambition. I don't want to wait 1 year to be ambitious on this. I think the ambition has to start right now here with all of us engaging and promoting and making sure that we are not missing one single opportunity to generate health. Thank you very much.
Thank you so much, Maria. That's really very much what we wanted to say with this event, in that ambition can't wait, and that health people are some of the most ambitious ones you could talk to in terms of climate action, and are so helpful for others in terms of how we can build not just faster and stronger climate action, but also more equitable and fairer and often more popular climate decision making. Just to say something quite personal before we kick off, when I started working on climate and health, as someone who'd worked on climate for a while, a couple of years ago, I said, what have I put myself into? I joked that every week my colleagues would tell me some other way that climate change was kind of kill me. Don't look at the fungus question if you're feeling depressed, is my tip on that. But then I realized, there's actually so many solutions in the health space. There is so much hope, because we know that climate change kills. We know that climate change hurts. But if there are people on this planet that are good at protecting us against things that hurt us or might kill us, it's the health professionals. It's all of the research infrastructure, the health delivery infrastructure. It's one of the best things that humanity has done. And we should be mobilizing that to tackle the biggest crisis that we're living with, which is the climate crisis. So I think we've collected some really great speakers that we know us walking across a range of different areas in mitigation and adaptation, in mental health, in air pollution, with youth, with energy. So I hope we'll have a nice range of different perspectives here. I'm going to introduce them all, and we're going to ask them a kick-off question where they're all going to speak briefly, and then I'll talk to each of them in turn, and then we've got a final question. And I hope we will get through that before they kick us out in 50 minutes. So we have Jane Burson from... First question my colleague asked me when I said I was going to use an iPad was like, have you got your touch thing? Because it's really difficult when people check things. I've got it done. We've got Jane Burson here from Clean Air Fund. We've got Hartisha Amesh from Youngo. We've got Caroline Uchong from the International Renewable Energy Agency, Irina, and Abhit Solomon right at the end. Hi, I can still see you and we can hear each other because of our wonderful headphones, who's Senior Advisor at UNICEF. And my first question, and we'll just take it in the order that we've got here, is just as a kick-off, following on from the great remarks we've had from Maria, where in your field of work are you seeing health leading to better, more ambitious climate action? So Jane, start off.
Thank you. So I want to really build on Maria Niera's comments because the Clean Air Fund works on reducing air pollution for health and for climate reasons. And Maria covered incredibly well all of the reasons that we would do this to save lives and to improve people's quality of life. It might not be obvious exactly how air pollution and climate change are linked. There's two different ways. The first is that some air pollutants that harm our health are also really bad for the climate themselves. Some super pollutants like tropospheric ozone and black carbon or soot. They're really dangerous for people, and they both have a global warming potential of about 1,000 times per ton of that of carbon dioxide. And the second one is, even where the pollutants aren't directly bad for the climate, they're emitted at the same time as greenhouse gases. The vast majority of outdoor air pollution is from burning fossil fuels. So if the sources are the same, then the solutions can be the same, and climate action is very often action on reducing pollution. And the reason that it's pushing air pollution action is pushing more ambitious climate action is exactly this point that you made, Alice, about making climate action popular. I spent 9 months on secondment as head of climate science in the British government. And one of the things that the government does, and I know it happens in lots of countries around the world, is they run a survey about public attitudes to climate change. And the survey asks things like, how likely are you to recycle? How important do you think climate action is? And very regularly, for about 20 years, 2/3 of people say they're somewhat or very concerned about climate change. But then when you look at, when I was looking, because it was my team's responsibility to do the greenhouse gas inventory for the UK, when I was looking at the stats, back then only the power sector was being decarbonised, not transport, not heat. In fact, emissions were going up. And they're the things where you really need people's buy-in, because it needs changes in behaviour and it needs people to vote for those politicians that will make them change their behaviour. And I think air pollution is the way into that. We've seen, for example, in London with the ultra-low emission zone, people buying into this policy that will really seriously restrict the entry of diesel and more polluting vehicles into the city centre. It got some opposition, but actually the support was way bigger. We saw in Poland people very supportive of a domestic coal burning ban, even though Poland is Europe's second largest coal producer, and this was during the invasion of Russia into Ukraine and a lot of personal worries about energy security. People still keen on a domestic coal burning ban in the Masovia region of Poland. And Maria mentioned the pollution covering New Delhi at the moment. A lot of it is coming from burning crop stubble in the fields in the Indo-Gangetic Plain. And the Indian government has put in place, because of air pollution reasons, a mandate that all coal-fired power plants need to burn 5% of this waste biomass instead of coal in their plants. So that's reducing the burning from the fields, because the farmers can now harvest that crop stubble and sell it to the coal-fired power plants, and it's reducing the amount of coal that gets burned because they're burning waste biomass instead. And all of this is happening because of desire for a reduction in pollution and a desire for a reduction in the health harms that it's causing.
Thank you. I think clean air is often our first stop on this, and it was great that you could be our first stop there. Moving on to Harshita, who you bring a really interesting perspective as being one of the health focal point in Youngo, but also a medical doctor. What about you? Where are you seeing health really helping build more ambitious climate action?
Thank you for your question. So I'm just going to build on what everyone has already said. I'm also from India, but I'm not from New Delhi, so thank God for my lungs. Whenever I speak at these places, I always speak on behalf of my patients. And I actually studied in one of South India's biggest government hospitals. And what I realized is I can provide people with information. You know, as a doctor, every day I talk to at least 300 people. It's a lot, and my mouth and my jaw hurts at the end of it. But what I see is that if you're able to get someone to care about something, then they're automatically going to work on it. And the best way to get them to care is to tell them that they're dying, unfortunately. But it really works because a lot of times, especially in India, where like our education rates aren't really the best, but it's improving. Patients always are trying to find out, okay, what can I do to access healthcare services better? What can I do to prevent myself from coming to the doctor as often? Because out-of-pocket expenditure is still something that they're super concerned about, though our healthcare systems are great. Being able to actually tell them that, hey, tomorrow is going to be better for you is not supposed to be a false promise that I'm making to them, because they're consuming a lot of harmful chemicals, whether it's from their food, it's from their drinking supplies, it's just from the air that they're breathing, or even if it's just from the medicines that they're taking at this point of time. So what we do is we try to backtrack a bit. We try to understand what are all the different social determinants of life that's actually affecting their well-being, and take it there and say, okay, is the surrounding around you clean? If it's not, what can you do to make it clean? Are you burning coal gas at your home itself to cook? Can you instead convert to something that's not that harmful? So I think when you start talking to people in a language that they're able to best understand, giving them one small, simple task that can switch out one small thing and multiply that by the billions of people that live in India at this point, doesn't that lead to enough action? And health is such a powerful and compelling argument because at this point, who doesn't want to live longer? And what is the best resource? My mom always keeps saying that wealth can probably buy you everything, but health is the best wealth that's possible. And that's there. So protecting your health and well-being is, I think, your prerogative. And you should, as healthcare professionals, we are at the precipice. Because if I tell you something that, hey, I can do this for you, but you just need to give me a hand, you'd probably believe me. But if your politician comes and says tomorrow that, hey, I'm going to pass this legislation and you're going to be okay, would you believe them? So I think that as healthcare professionals, we also have that duty to advocate for climate action, but also to bridge the gap and explain to them in as simple terms as possible, what can you do?
Thank you. And from the medical profession to the energy field, Caroline is energy specialist at IRENA. Where do you see health? Does health come up and if, do you see it raising ambition?
Yes, so thank you for that question. And so I work in the area of energy and where I focus on energy access, so electrification and clean cooking. And there's quite, it's one of the areas where I can see there's a very positive story when one looks at how health has supported in this agenda becoming prominent. So we have approximately 2.1 billion people in developing countries cooking with polluting fuels. And this pollution is not just the particulate matter and other pollutants that affect health, but also there's black carbon and there's greenhouse gas emissions from fuel harvesting. So the issue impacts on climate. So now, quite a long while in the past, the focus was this was called the hidden killer in the kitchen because it was affecting women and children in remote communities, and there was not so much attention paid to it. And then a lot of research started coming out showing that cooking with biomass fuels has serious impacts on health of women and children. Before then, national governments, there was less concern. When you went to, say, Kenya, for instance, where I come from, and you talked of which are the sources of energy used in the country, they would refer to fossil fuels for transport and so on, and nobody was talking about household energy use. So then with the more strong communication about that this is also a health issue, then there's been a lot of response, because then there's more connection and recognition that this is an issue that affects us. And so increasingly government has responded. And as they have responded, including, for instance, setting national strategies for clean cooking, setting targets, raising more ambitions, so both the national governments and the global community, then it means that the issue is addressed with the benefits not just for health, but also for the climate. So it's easier to make advocacy based on health because, I mean, as the other speakers have said, it's personal. One sees it. And then you say, when you refer to health, especially of women and children, then it evokes a response, especially both including at the local government, compared to when you say it's about climate, then questions start coming about how much climate impact is, say, Africa or rural households contributing to. So that's one area. And the second area I'll also mention is when it comes to electrification side, for instance. So where you have a lot of healthcare facilities with no electricity, and then or there's low quality electrification, which means that when the power goes off, then they have to use backup fuels, diesel, like generators and so on, which again contribute to climate impact. And then this has also been a topic that has been WHO and other health agencies have been tackled, been trying to promote, but not much happening from the energy side. And then when COVID happened, then it becomes very clearly apparent that actually you need the healthcare centers to have energy because it's for vaccine storage and so many other factors. And then that brought also into the discussion, okay, you need electrification to retain healthcare workers and so on. And so then as you get a response on this, then again, it benefits in terms of the climate action as well. So just saying that we need to phase out diesel generators because they have climate impact will generate lesser of a response and urgency than saying we need this because there are all these health determinants that are affected. So those are the key areas.
Thank you so much. I think those made such a important case for the intersections between climate action and health equity, both by showcasing what otherwise would be a hidden killer and making sure that we see these things, see these impacts and who they're impacting, and also things like the benefits that can come through the COVID example. Finally, Abhit, we've got you at the end, but we know you'll make yourself known. As Senior Advisor at UNICEF, focus on youth. We've already had a little bit about youth. I'm sure you'll pick more of that up. Where do you see health coming in to help raise climate action ambition?
Thank you for that question. Well, since 1990, there's been so much progress on children's health. We've reduced globally child mortality by 60%, and that's phenomenal, the amount of progress. And we've all witnessed it. We've all talked about one of the biggest successes of public health. Now, with the support of Wellcome, WHO, Karolinska Institute, with many partners, we did a scientific stocktake of where we stand when it comes to the impact of climate change on children's health. And we produced this report, a Threat to Progress report. Some of these leaflets are kept there, and it's got a QR code. You can go to our website. But essentially, there's some very important stocktake. The stocktake has revealed some very important findings as it concerns children. And I'm going to speak to some of those big lines that are there, that climate change is not just changing the planet, it is changing children. It is impacting almost every aspect of child health from pregnancy to adolescence. And that's what we've looked at, the different phases of childhood in pregnancy, in infancy and childhood, and in adolescence. And this report, of course, speaks to some of the impacts we've heard today, but we all know what they are, what the climate impacts are, climate hazards are. It's about extreme heat, it's about droughts, it's about floods and storms, it's about wildfires, it's about air pollution, it's about ecosystem changes, which the report highlights. But if you actually look at the science that has been sort of consolidated in that report, you will see the range of impacts in terms of pregnancy complications, in terms of adverse birth outcomes, in terms of child malnutrition, in terms of killer infectious diseases like malaria, non-communicable diseases like asthma, impact on neurodevelopment and mental health, including developmental delays, cognitive dysfunction, and depression, injuries, and and effects on well-being, including the loss of learning, violence and abuse, and exploitation. So if you look at all of that, the range of impacts that we are talking about, what this report is, it just changes the narrative in terms of what this means. And I think it has changed a lot the way we are approaching climate and how we are thinking about it, because we are actually challenging the purpose of climate action. Well, the purpose of climate action is to protect the future, isn't it? And so that future is children. And therefore, we need to do all that it takes to actually take the action. Yes, as Maria said, we've talked, we've made the promises. It's time to really act. And therefore, in terms of our advocacy, for the first time, we've been much more specific about the unique vulnerabilities of children in pregnancy, in childhood, and in adolescence, and how they're impacted by climate change across these hazards. We have, of course, counted the disproportionate impacts on children, but we've also come out with some really strong recommendations in this report, which is not only in our advocacy, but is changing how we think about our programming as well. As you know, UNICEF is in 190 countries, and we are trying to act on a range of these hazards, right from the preparation to the humanitarian action that is required. But just to talk about some of those recommendations, I think the first big recommendation there is to actually stick to that 1.5 degree promise. But within that, there's a lot of things. We need to end cooking poverty. That's one of the top recommendations there. We need to move towards greener infrastructure, climate education. But one of the recommendations we do not talk about often enough is that the decarbonization strategies need to be accompanied by detoxification strategies. What we are seeing is a flurry of new technologies and old technologies, and they are contaminating the environment in a big way, and it's hurting children. I can speak to one of them, which we are deeply familiar with, is the issue of lead-acid batteries, which are very, very popular in South Asia and East Asia, where it's a flurry. You have e-rickshaws using 4 batteries, they will last for a year, and then they have to be recycled. They go somewhere to get recycled. And I can tell you that everywhere we're testing children, we're finding half the children poisoned with lead. And those are some of the challenges we are seeing in terms of how these things are rolling out and playing out in terms of what the impacts on children are. The second one is more about protecting children, and there's a range of recommendations there. I'm not going to that. Please read the full report. Back to you, Alice.
Oh yeah, do please read the full report. I know, when you were speaking, it was reminding me of a line that I often find haunts me from, I think it was Boutros Ghali in 1992 at the Rio conference that kicked off all of these many conferences, where he said, if we don't act now, then the storms are going to hit our grandchildren, or children, except those children now have children. In fact, some of them probably have grandchildren. And, we're at COP29, 29 years. Even people on this panel probably are much younger than COPs, and we need to stop just talking about the future and actually building it. I've got a question sort of more specific for each of you now, and I'm going to pivot, I think, from some of the health nerding to a bit more of the climate nerding. Jane, tell us a bit about super pollutants, because it's been really amazing to see the way that Clean Air Fund have been engaging in the super pollutants discussion, and how action here is going to help not just near-term warming, but human health.
Thanks. So I mentioned super pollutants as one of these links between air pollution and climate change. And you'll all know about the huge success that countries have had in starting to tackle methane. There's the Global Methane Pledge. There's been more than $1 billion in grant funding allocated to methane. That's one of the super pollutants. But there's some that aren't being tackled very much at all, and they are the ones that are really bad for health: tropospheric ozone and black carbon. Along with methane, they're collectively responsible for half of the global warming that we've seen so far. So it's quite unbelievable that they're not included at all in the UNFCCC framework. They're only voluntarily and only in a small way included in countries' NDCs, and they're unable to access climate finance. But they only stay in the atmosphere for a really small amount of time. So if we can stop emitting them now, they just won't be there anymore. And if you're worried about accelerating temperatures, this is an amazing way to slam the brakes on. So why aren't they included, you might ask? They're both kind of complicated. For tropospheric ozone, I think many people will have heard of ozone, and you think of it as a good thing, like we like the ozone layer. It's protecting us from UV rays. It acts differently when it's in the stratosphere, which is where we want it, and in the troposphere, like nearer to the ground, where we don't want it. And it doesn't act in the same, it's never emitted. It's produced through secondary reactions, chemical reactions in the atmosphere. So you can't handle it in the same way that you would handle other emissions reductions, because you can't say who emitted what. You can only say who emitted the things that create it. One of which is methane, but there's other things, NOx and non-methane VOCs, they're called. So we have to think about how we go about reducing it and how we go about setting targets for it a little bit differently. On black carbon or soot, one of the main ways of producing it is through unclean cooking, and so it has been tackled a little bit through the clean cooking movement, but there's lots of other things, basically burning stuff. Anywhere that you can see black plumes, that's black carbon. And as well as having this temperature effect, because it's black and it's absorbing radiation and re-emitting it, it has other climate impacts, like when it lands on snow and ice, it makes them black, and so they absorb heat quicker and they melt really fast. So it's creating water insecurity as well. It's melting glaciers, and that isn't included in the way that we calculate carbon dioxide emissions reduction, which everything is translated back to. So the vision for these two things, now that they're finally coming back on the scene, is two things. One, that countries should include them in their nationally determined contributions or climate plans. There's 18 countries that have already done it. There's a clean air scorecard for the NDCs, and you can see who's in there. Very interestingly, it's actually developing countries that are the ones including these things, especially black carbon, because they can see the health impacts and they can see the impacts on the snow and ice that's around them. And the second thing is that they need to be able to access finance. You know, this is the finance COP. We're all talking about this new collective quantified goal. These two things have the potential to really reduce warming, but they are not at the moment able to access climate finance.
Yeah, and after you've read the UNICEF report, do go straight to the Clean Air Fund website to look at all the stuff they've been doing on NDCs. It's been brilliant. Harshita, so much of what we've been talking about so far has been on physical health, and at Wellcome, it's very important to us that we acknowledge mental health is health, and that we raise that in every one of our events. And I know that it's something that you really think about too. So could you tell us a bit more about the mental health part of the picture?
Okay, but I think a couple of speakers have already also covered that. I think what Marianaria said was sometimes people don't really realize the consequences and what's actually causing this. Let's just backtrack a bit and talk about how you feel every single day. Have you found it hard to concentrate? Well, I'm sorry, have you found it hard to concentrate when it's hot? Or when you keep seeing like winters that are extending, do you find yourself feeling really sleepy, really tired? Isn't that just your psychosocial well-being? Oops, that's a lot of words. But just think about that. And now think about it happening every single day, right? A lot of times when people talk about mental health, especially in the climate space, the words that we hear thrown around a lot are about eco-anxiety or about ecological grief, where we say, okay, I'm really anxious because my climate is changing and the environment around me is changing. Or nostalgia, where you have a nostalgia for an environment that you no longer face. For example, I come from Bangalore, and when I first moved back to Bangalore in 2008, it was known as the Garden City of India. And unfortunately now, it's called as the Garbage City of India. It's not even been 20 years. What's happened? But also when we talk about this, and we're coming back again and again to COP, aren't we like really just burnt out and despaired? Like, what is happening? The argument for climate action, even the argument that the climate crisis is a health crisis, is something that's being parroted again and again and again. But we're not seeing enough ambition to actually enhance our action. And how many of you just at the end of each day at COP, or even by the second week, I know some of you are new faces, so I'm so glad about that. How many of you have just felt tired? You're just like, why am I sitting in this negotiation room? Like, why can't people just come to that? Where is our need for care? We are actually hosting care spaces every day from 6 to 7 at the CS Hub. If that's of interest, please go there. But those are all the impacts of climate change on your mental health, even if it's not something you've directly realized. But coming back onto the ground and what happens every day, it's not just about waiting for the next disaster to strike. It's about, okay, I'm feeling suffocated in the air that I'm breathing. It's about the people who are living in Delhi or Lahore or any of the 10 most polluted countries. And also because the infectious diseases are changing. And it's not only about how they're changing, it's about like the mutations that happen, leading to more psychiatric illnesses that come after the disease has happened. Or as Abith mentioned about for children, just imagine from pregnancy, you're not getting the right nutrients. How many children are being born with cognitive delays, about neurocognitive diseases, having developmental issues? We don't deserve that. We didn't cause this. We have just arrived here, and we're standing on your side and fighting alongside you. I think as a personal take, as a young person, I would say that being the only young person on this panel, and yes, I'm younger than Kop, I think we need more intergenerational collaboration because we come with enough enthusiasm. We're 1.8 billion strong, and that's 1.8 billion voices calling for the same thing, saying that I not only want you to protect my well-being, which is the environment around me, but I want you to protect me as well. But not just look at me as a population group that is vulnerable, but as a population group that is powerful in our own right and in our own voices. So it's not just about talking about depression in winters or something that's seasonal, or talking about stress disorders that happen after disasters or even because disasters keep happening, or schizophrenic illnesses in migrant population groups, or even post-traumatic stress disorder or postpartum diseases with mothers not being able to cope with the nutrition that they have to give to their people. It's about how can we work together to ensure that we feel well, because the WHO definition of health says it's not just you being in the best of your health, but it's also about you not being sick, you know? And I think to do that, also at COP right now, because health, while the financing for health is quite less, the financing for mental health is even more less because it's considered non-economic loss and damage. But if you're not a healthy person, do you think you can show up to work? Do you think you're able to contribute to the economy? Do you think you're able to just exist? So I think like when we're talking about humans, I think it's our mental health or any health for that matter, it comes back to thinking about who are we, what do we want for our planet, and what is our shared humanity in all of this. Thank you.
Thank you so much. That's lovely. Thank you. Thank you to the audience for doing that too. Caroline, you touched on this a bit earlier. But the issue of energy access and how that intersects with some of the stuff we've been talking on. You're a real expert on energy access, and I wondered if you could say a little bit more about how health can work within the really important question of energy access.
Okay, thank you. Yes, so in my first intervention, I talk of how health has helped to raise the profile of the issue of energy access. But of course, after raising the profile, then what? We can't just talk about it or acknowledge it. There needs to be action. And so Irina works on renewable energy, and that includes the target of tripling the share of renewables in the power generation, and also tracking that progress. And if I use my example, so I'm from Kenya originally. I lived in Sweden for the past 12 years. And I look, for instance, at the potential of, say, Africa. We are talking of lack of electricity and lack of clean cooking. How many hours is there sunshine in Africa relative to, say, Sweden, where a large share of power is actually generated through renewable energy, even though you have sunshine for just a few hours a day. So it's well, what we really try to push and advocate for is the resource potential is there. There's technology. Technology exists, and that's why in Sweden I can have power generated through solar. So the technology exists. There's a commitment and push. So what really is missing? And we can say there's lack of finance, but there's actually not a problem when it comes to supply of finance, and then as well as demand for it. So there's just a missing connection. So based on the estimates, you need about $8 billion a year to tackle the problem of clean cooking. The cost of not doing it is in trillions. So it's how do we get this finance to move where it's needed the most? And what our Irina's research shows, for instance, is there needs to be more action here. If you look at renewable energy deployments, 80% are in the north, and just less than 20% in developing countries where you need it to tackle things like clean cooking and electrification. If you look at finance going to renewable energy, it's less than 3% in Africa. So how do we then get that finance move and then use to tackle this challenge? So what's more needed is just more commitment, and it's really good to increasingly see countries taking ownership of the agenda and pushing for it. But then, yes, more support, more partnerships, and more action is needed to then make this goal be realized. Maybe just one point to add in terms of electrification. So we still have about 680 million people lacking access to electricity. And what the progress report tracked by SDG 7 custodian agencies show is the remaining population that's unelectrified, the only feasible way to do it is actually through distributed renewable energy. Because otherwise, those that could be connected through the grid and other forms have already been connected. So it's not just about renewables as being a good thing or good for climate, but it also then the most cost-effective solution of achieving this agenda. And of course, when we get then the electricity access, then it creates opportunities for clean cooking and for health in terms of electrification of health facilities and those other health outcomes that we are aiming to achieve while also achieving climate goals. Yes.
Thank you so much. Yes, I mean, it's health and climate action together. And I think we are, I was going to say we're stronger when we're together, and I'm thinking it's cliche, but it's true. It's an example of how we can help each other and things that seem obvious we should just do. Abby, I was going to ask you, it's just that nothing really shows the inequalities of climate change more than the impacts on young people. And I was going to ask you to expand a bit on that, but maybe you already have gone through some of those. So if you wanted to talk more about the climate impacts on young people, please do. But also maybe do you want to pivot to some of the solutions that we should be thinking about to you know, we said we shouldn't just be thinking about how climate and health helps us understand how terrible climate change is, but also how health can help us think about our way forward.
Thank you. I'll delve a little bit on the unique vulnerabilities, if that's okay, because I think I spoke in terms of health impacts, all of these things that are just too many to even list out, frankly. But I think what's important to understand really is that children are not little adults, as any pediatrician will tell you. They have a unique physiology, behavioral patterns, and dependence on caregivers that makes them particularly unique. So if you look at pregnancy, and you could look at some of the vulnerabilities I'm going to talk about from the lens of extreme heat, or you could look at it from the lens of air pollution. It'll sort of play out that essentially, if you look at extreme heat, that a mother's body is able to maintain a healthy temperature for the developing fetus. But then excess heat is linked to babies being born prematurely because it impacts the amniotic fluid in the developing fetus, and that's a result of dehydration. It impacts breast milk production, and you've got adverse birth outcomes like preterm births, stillbirths that are linked to pregnancy, to excess heat. And that's essentially, there's one report that talks about, in this report that we produced, that the odds of stillbirth and preterm birth rise by 5% by every 1 degree increase in temperature. So that's how it sort of plays out, and I think it's important to say, yes, vulnerable, what does it exactly mean? How does it actually play out? If you look at in childhood, if you think about a child that's a newborn, you think about the body weight of that newborn, and you think about by the first year, that newborn is almost going to triple their weight. And why is that happening? Because they're eating more, they're drinking more, they're breathing more compared to their body mass. And that is actually how it's playing out. So think about what happens when there is a scarcity of nutritious food. How will that impact the child? That's why you see so many pictures. When you look at droughts, you see the pictures of children that are malnourished. And that's because it's a very, very important time for good nutrition, and you sort of have this impact. And malnutrition is not something that you can always fix because it's stunting the potential, it's weakening the immune systems, it's making them more susceptible to infectious diseases like diarrhea, like pneumonia and malaria. And then you have this whole issue of food insecurity that can often be played out at the same time. So, and then let's think about adolescence, because yes, a child has grown up, they're older, they are able to they have better immunity, more developed bodies and brains, but you have the executive function that is still developing, and they're navigating through complex emotional and cognitive growth processes. So we're talking about, the skills they are still developing around decision-making and impulse control, and what trauma and instability does to those developing minds, and how that will impact a lifetime. So I think those are some of the vulnerabilities we've sort of outlined in the report. And I think those are always important to sort of bear in mind as we think about children, because yes, to Harshita's point, we can talk about vulnerability in many ways, and these are some universal vulnerabilities. It doesn't matter where you're born as a child, these will be the vulnerabilities that we will have to confront. And of course, children that are most disadvantaged are the ones that are most vulnerable. Air pollution is a fantastic example of just how those inequities play out. If you look at the number of air pollution-linked deaths, a child in sub-Saharan Africa is 100 times more likely to die from diseases linked to air pollution than in a high-income country. So those are also some things to bear in mind.
Thank you. We're starting to get to near time, so I'm going to ask each of you to finish with just some remarks on, it's the classic COP question. We're just over halfway through. What for you would be a good outcome for health at COP29? And I was going to reverse the order, but actually I should let you breathe again. So I'm going to go the same way, but that means you get the last word. So Jane, what would be a good outcome for health at COP29?
I think 3 things. One, list the super pollutants by name in the outcome text. That's not been done before, so this is part of the reason that these super pollutants haven't got the recognition that they need. 2, encourage countries to put them in their nationally determined contributions and provide money to do it. The Climate and Clean Air Coalition is helping some countries. We've just started a partnership with UNDP to fund some countries to do it, but there needs to be finance for everybody who wants to include it. And then number 3, obviously this big new collective quantified goal, and that can also be that climate finance and health finance can both prioritize the same kinds of action, because we are seeing some actions at the moment like investment in biofuels, which are good for climate change but not so much for air pollution, and so therefore not good for health. So we would choose different things if climate funds prioritized health.
Thank you. Harshita, what about you?
Well, I think I want to say the one thing that's on everyone's mind, a fair, fast fossil fuel phase out, a world that's fossil fuel free for sure. But also as a young person, we need to include children and youth in all their diversity at all levels of decision making. And I'm saying as much of diversity as possible, because we often see the same child or the same young people at panels, and that's not helpful. Also on that context, we have from Youngo, when we do lobbying, we have something known as a Global Youth Statement. And this year's Global Youth Statement is over 80,000 hours, over 80 countries, and with 1,200 inputs from children and youth across the world. And these are all negotiation-aligned demands. So if there's any negotiator in the room, you can just read the text, pick it up, and put it in. And that's also quite helpful. But also, if there is any negotiator in the room, at Youngo Spokes every day from 9 to 10, for anyone who's attending COP for the first time, we give them one task. And that's to help them understand the process better. So I would say that one task to anybody would be try to get health into the text in any context, whether it's about the super pollutants that's been mentioned, the unique vulnerabilities of children, or the renewable energies that we're talking about. There's so many ways that we can talk about health or health co-benefits. And I think that's really helpful, because right now the NCQG, and I haven't seen the latest text, but it had right to health mentioned in brackets. So if that gets adopted, I think that's a win for all of us on this panel as well. The third thing that I would ask is to have mental health and psychosocial support mentioned across adaptation, mitigation, loss and damage, and finance. It is time to stop viewing health as a non-economic asset. It is an economic asset. Imagine the out-of-pocket expenditure or any of the things that we've spoken about in this particular panel. So mentioning those keywords and financing for it, I think, as all of us have been calling for, would be really helpful.
Thank you. Caroline, what about for you? Where would you see, what would be a good outcome for health for you for COP29?
Yes, so for me, a good outcome is if we leave feeling the need, the urgency and the need to accelerate progress, especially on some of those indicators linked to climate, and just not see them as numbers. So if we talk 2.1 billion have no access to clean cooking, to just think behind the number that you are talking of, and those without electricity access. So you are talking of others not being able to sit in a room like this with lighting, or the fact that for somebody to cook, they are not just going to switch on a cooker, but they have to first go and forage for wood and prepare it and light it and all that smoke. So and then to link that to the fact that technology for solving this exists. There's a capacity, there's finance, and so all this really needs to come together. And in addition to that, then there's really, as part of that urgency and acceleration, there's a need to collaborate more across sectors. So for me, it's natural to link energy agenda with a health agenda, because I did my PhD in public health and I've been working in energy. There's quite a number of energy colleagues who don't see and don't actively try to see the interconnection between the work they are doing and how it impacts on health. So just building those strong collaborations and partnerships across sectors would help, because at the household level, it's the impact they feel. It's not about, okay, this is to do with health, this is to do with energy, this is to do with something else. Yes.
Thank you. And finally, Abhit, what about for you?
So this is a finance COP, so we have to speak in finance terms. So here's another stock take that we did. We found that 2.4% of climate funds incorporate child responsive activities currently. But children make up 30% of the world's population and 100% of the future. So what do we want to see in the COP? Well, we want to see a dramatic increase in climate financing on children, particularly their health and well-being, their future. Secondly, we want to guarantee that all climate plans, whether it's NDCs or NAPs in every country, are child-sensitive to protect their health. And a third thing that we're looking for is a cover decision that includes an explicit commitment to respond to the unique and disproportionate impact of climate change on children. We feel these are things that need to be fixed, and they need to be fixed immediately without any delay, because future generations, which are made up of children, will hold us accountable for the climate action we're taking today.
Thank you. Thank you all. And just to sum up and to look forward, if any of you have got a taste for any of this and want to have more conversations about health, I know that right now, I think in some of the negotiations rooms, health is being talked a lot about in terms of the global goal and adaptation. And do check out on the Wellcome Trust website the policy brief we wrote about health in the global goal and adaptation, if that's your bag. If you haven't been to the Health Pavilion, do have a look at that. It's slightly confusingly labelled on the map the COP29 Health Pavilion, so don't look under H for health or W for WHO, look under C for COP, but it's in the B zone just around the corner. There's a huge programme of all sorts of exciting discussions going on this week as well as last. And we will be convening at the end of the week on Thursday at 4:30, if any of you are still around, in the UK Pavilion, another event talking about the power of health and climate action, but really looking towards next year, the road to Belém. And thinking about the role of Indigenous voices and a range of other people in the climate and health space. But thank you so much for coming. We were worried we wouldn't fill this big pavilion, and we've got standing room only. And thank you so much for such a wonderful set of speakers and all the things that you brought to the discussion today. Thank you.